Hi, I'm Dr. Jaffer, and this is Got Teeth. All right, so today I'm talking with Dr. Volinder Dhesi. He's been one of my partners for 15 years in our organization. Most of you may know him by Wally. That's what his friends and family call him, or Dr. Wally at times. So Wally, today we're talking about cosmetic dentistry. I know it's one of your passions. I hear you talk about this all the time. And there's a lot of new stuff coming out there, and there's a lot of stuff that's actually tried and true and tested and it's worked for many, many, many years. So give me a bit of a kind of a play of the whole field. What's going on with cosmetic dentistry? What have we done really successfully? What works really well? And what are some of the new technologies that are coming out of there and stuff that you're seeing that's changing the way that we now do things? Because there's some really cool stuff out there.
Yeah, no, thanks for having me. And so, cosmetic dentistry is a really interesting field because, pretty much everyone wants to have a beautiful smile. And things have transformed and changed as this really big movement towards being as conservative as possible. And that means we want to preserve as much of your healthy tooth structure. We want to basically preserve as much of your own teeth. And now the technologies and some of the types of procedures that we can do allow us to do just that. I've been a dentist practicing for 17 years now, and it's interesting to see the evolution of where we were and where we are now. One of the big things I've noticed personally was this change from just had these really bright white smiles, and sometimes you could spot these people from across a room. And now a lot of the cases we do are very subtle. These people just have beautiful smiles, oftentimes very minimal work's done to accomplish that. So certainly from a procedural point of view, and then the technology is really what's changed everything. What happens is we're able to use certain types of technologies using just some basic photography and computer software where we can mock up a smile and try it on, first of all on a computer screen just to see and make sure that we get everything perfect, like how long your teeth are, what shape they are, and get things just the way we like it. And then we're able to print a mold that essentially fits over your teeth so we can even just try out the smile without ever doing anything to your smile. Also, what's made a big difference is the inclusion of Invisalign in a lot of our cases. And sometimes it's not uncommon for us to use clear aligner therapy to just simply align the teeth a little bit better, really to maximize the smile. And in some cases, that's all the people need. It's just simply some clear aligner therapy just to align their teeth, and maybe some whitening, oftentimes maybe just a little bit of bonding. So we have a lot of different options at play here, but our goal is to give you the best quality smile, hopefully doing the least amount of work. Really, that's what it's about.
So it's interesting because I agree. Like I think it's come such a long way. I mean, even in the topic, we started out with calling it cosmetic dentistry. A lot of people now call it aesthetic dentistry. So it's almost a little bit of a change as to how we're doing that. And I like that because we want to save tooth structure. And I mean, at the end of the day, we're dentists. We want to give you a beautiful smile, but we want to do it as conservatively as possible. So let's walk through a few of those different things. Let's just start with some of the simpler ones, like doing some clear aligner therapy. Are you finding that is successful? Can you do that well with adults? Because I know that we think about braces, we think about Invisalign, and often we're thinking about 12-year-olds or 10-year-olds or 14-year-olds. Is this something that works well for adults?
Yeah, and it's a great question because that's another huge shift. I've been doing some form of orthodontics now basically since I've been a dentist for the last 17 years. And what's interesting now, almost all my patients who do clear aligner therapy are adults. And I usually like that because for many people, that's often all they need is clear aligner therapy. Clear aligner therapy, either using Invisalign and some of these other products out there, is extremely efficient in that many cases will take anywhere from 4 months, 6 months. It's usually done in less than a year. And from there, oftentimes, either we're done or maybe some minor bonding. I would say that makes up a big majority of the cases. So people are able to achieve their smile very conservatively in a very short period of time. And even then, the costs have come down tremendously. It's funny, we always have inflation and we joke around about how things used to cost way less way back then. That's actually one of the few things we have that have over time, because of how efficient it is, because of the way the treatment is delivered, the costs have actually come down on it. So that's where people really like that type of treatment. So really, a majority of adults do clear aligner therapy. Very simple, very conservative, and really non-invasive to their lifestyle. and they're able to wear these aligners very simply. People don't even really notice that they have them, especially if they're in jobs where they're constantly communicating with people. It's an easy lifestyle change to make for sure.
So that's great, and it's actually interesting because I had braces when I was a kid, and then mid-30s, a little bit of relapse on my case. I did Invisalign, and patients didn't know you had them in your mouth. But you mentioned something else, and I want to make sure that we talk about that. You said bonding. What exactly is bonding?
So bonding is the ability to take a type of resin material, and in some cases just add it to maybe the edges of the teeth, maybe in between the teeth, so we can improve the contours of the teeth. It does have its limitations. It's not the all end all for every case, but it's conservative, and it allows us to get a fairly reasonably quick result. And again, it's wonderful for minor enhancements of teeth. So what I'm oftentimes finding is that people who have their teeth in either crowding or maybe the relapse for previous ortho, sometimes they'll have worn off some of the edges of the teeth, and some of the minor bonding options allow us to first of all align the teeth and then go ahead and rebuild the teeth back to where they were. Sometimes people will come in asking for bonding from the get-go, and that can be a little bit challenging because we have to remember what caused their teeth to be worn down, and if we don't fix what caused their teeth to be worn to begin with, bonding isn't necessarily a good option because a bonding will likely break off easily. So it does have its limitations, but for a lot of people, the one thing they love about it is that it's fairly quick and easy to do. It's conservative, and even from a cost perspective, it's actually it's very reasonable in cost to do as well.
Awesome. So one of the things that I think I'm excited about to hear a little bit more about, because it's definitely on the forefront of what's going on, is at the beginning you mentioned, like, we can actually try teeth or get to see what our smile is going to look like before we do this. Because I know in the past, when I was doing cases like this, we'd take this model and we'd put some wax on it, and we'd show the patient, say, this is what your teeth are going to look like after, and the patient would look at the model, and there was no way to figure out how that actually worked. So you're telling me now we can actually try that into the mouth for the patients?
Yeah, and I think that's a big thing. So depending on the certain cases, like when we start thinking about doing veneers and some of the other options, it can be a bit of a big commitment. It can be a bigger financial commitment. It certainly can be a bigger time commitment, and certainly it's a permanent result. So one of the things, it's like you mentioned, in fact, one of my first mentors for cosmetic dentistry was your dad, and that's how we did it. We would get these beautiful wax ups, and we'd show people these teeth, and certainly when they sat on the desktop, they looked beautiful, but how did we know how they're going to look in our mouths? And this is where the technology is incredible, because we know now there's a lot of elements that make a beautiful smile, but I will say this, there's no such thing as one smile fits all. Certain shapes and certain lengths of teeth look better in certain people. So now we have really sophisticated computer software that helps us design the perfect smile for our clients' faces. And so when we design it on the computer, and we start by taking 3D scans of the dental arches, so we don't use impression material anymore. We take 3D scans, we take photos, and all that information is input into the computer. And from there, we generate what we believe to be the perfect smile. And then from there, we actually 3D print those models and create a mold. And from that mold, we're able to basically try the smile in a client's mouth. Now, when we say try, it literally just takes me about 2 or 3 minutes to put it in, and you can actually look at yourself. In fact, we usually take a few photos. Even we'll take a little bit of video talking, so you can see how you look when you're talking. I certainly love when you get to go in the mirror and take a look at these things. And then shortly after, I can just pop all this right off. So it's really just a unique opportunity, something we never had available to us before. And if you ask me, it's probably one of the most profound things is to be able to allow people to vision themselves and see what they look like with their new smile. It's just like test driving a car. You get to test drive your smile, and it gets you excited. It gets you, really, charged up, saying, this is what I want. But for some people, it gives them the opportunity to maybe give feedback and say, you know what, maybe these teeth are too long, or maybe they're not quite what I was visioning. But the reality is that the computer software is so amazing. It's very rare that we don't have people who are blown away by the whole process.
Yeah, that's amazing. So you can actually get a feel, because I think obviously when they're getting into these cases, there is a level of investment. I mean, it's not something that, it's not on the reasonable side. I mean, there is some money involved in terms of doing something like this. But if you get the ability to at least see it or an option of it before, I mean, that's got to make the decision easier for people. And so giving them really a significantly better option, right? I mean, than what we've been able to do.
Right. And, it's interesting because, and I'm a general dentist, and I love doing all facets of dentistry. I still, I love seeing patients. I love caring for their mouths. I'll do fillings. I'll do crowns. I do all sorts of, aspects of dentistry. But the biggest thing for me is like I always want to make sure people who, trust their, oral health with me feel happy with what we do for them. And certainly the whole realm of aesthetic dentistry is interesting because in some cases the financial investment can be quite large, depending. And so it's important for me that when someone goes through the process, that when they're finished, they will tell me that that's the best thing they've ever done for themselves. That's our goal. And this is one of the important steps in making sure we reach that goal every single time. And so for us, this has been a really important tool so we can have certain levels of predictability. And like I said, our ultimate goal is just to have our clients have beautiful, healthy smiles, but more importantly, that they're happier than they've ever been with it.
And you bring up, I think, another good point in that is that, when we know the research shows that when people go and meet somebody, they look at their eyes and they look at their smile. Those are the first two things that I notice about, and dentists, the other direction, obviously smile first, but in general public, I mean, people notice your smile and they notice your eyes. And one of the things that, I know we get a lot of feedback from the cases that you do is it just makes them feel better about themselves. And there's a huge value to making somebody happier, no matter how you're doing it, right? I mean, whether you're doing this beautiful cosmetic smile or some Invisalign or some whitening, I mean, it really allows people are really tuned into their smiles, in North America especially, around the world I think, but I mean, definitely in North America. So, that I can see your passion behind that because you want to make people smile. I mean, at the end of the day, the goal of the dentist is to make people smile. So any last kind of pieces, any other things that you want to add in terms of like this kind of realm of aesthetic or cosmetic dentistry? Is there anything else that you want to tell us about that you think is important for patients to know?
I think it's really important we go back to the whole, the fact that, the materials we've used really have evolved tremendously. And the reason this is important for, patients who are interested in getting this work done is we've really said that like one of the most important things is to preserve as much of your healthy tooth structure as possible. One of the big things about people had when they thought back to cosmetic dentistry back in the early 2000s or maybe late 90s, and even for not too long ago, is that they always picture their teeth being drilled down to little nubs. That doesn't happen anymore. The materials that we use can be made down to thicknesses of 0.3 millimeters, and I'm telling you that it's very, very thin. And the benefit of that is that we can either remove little tooth structure, and in some cases we can remove no tooth structure, and we're able to get a beautiful, natural looking restoration that once bonded in place is incredibly strong. And we're basically doing our best job to mimic, Mother Nature in this case. And so it's the materials that allow us to be more conservative, but they also lend us to having a much more natural result from doing this type of thing. So really, it's the materials that have evolved tremendously that we have available to us now that allow us to give us, beautiful results, but long-lasting as well. These materials now have a lot of research done behind them that we know these materials are going to last a long time. I'd never want to lead anyone to believe that anything is forever, but we're seeing tremendous, tremendous results. In fact, it's interesting. I still get to see a lot of patients that your dad treated probably from 15 or 20 years ago. And it's interesting because the materials we're using now are evolutions of those material, but it's incredible to see how well those materials did. So I have so much, confidence when I see, some of your dad's old cases that he did 20 years ago, and they look just like he did them yesterday. And I'm thinking, wow, these new materials now are just that much stronger, that much better. What are these going to look like in 10 years, 15, 20 years from now? And I have the utmost confidence they're going to look fantastic.
Yeah, and that's a great point, right? Because if you're making an investment in your smile, you want it to last. And you want to make sure that it's done well and the quality's good, but that it stays, so you're not having to redo the work. So, I think that's great. I mean, it's amazing that we can now try these things in and do less work on the teeth. Again, we want to try to be as conservative as possible and then have them last a really long time. I appreciate that. Again, any kind of last pieces or anything else that we want to talk about in this realm of aesthetic dentistry?
Yeah, I think the interesting thing is for those who are interested, it's always good to just engage in the conversation with our dentists. And the good thing about Trek is that our dentists are constantly evolving their knowledge in this type of realm, and we're certainly it's something that would really encourage your patients to just to ask their dentist about their options. Clear aligner therapy is really popular amongst a lot of dentists, so a lot of dentists are doing that. So it's a great place to start for those who are looking. So really, my last thing is just to do your research. Certainly, reach out to your dentist and see what they have, and we all have slightly different ways of looking at things, and so it's fun to kind of see what they have to say. But that's the biggest thing, is just to start by reaching out to your dentist.
Awesome. Well, that was great. I mean, a lot of great information, a lot of ways that we can enhance our smile and smile a little bit more, which I think is important. I mean, in anything that we do, if we can smile a little bit more, we feel better ourselves. So I appreciate your time. Thanks so much for doing this.
Thank you.